Hello, and welcome to our Robert Wood Johnson Foundation First Friday Google Hangout on why nursing is key to a culture of health. I'm Susan Dentzer, Senior Policy Advisor to the Robert Wood Johnson Foundation, delighted to be serving as your moderator today. The Robert Wood Johnson Foundation has had a long-standing focus on nursing, and our discussion today will deal with how nurses are addressing upstream drivers of health and sparking innovation and greater value in healthcare. We've got three terrific speakers joining us on this Hangout today. Let me introduce them to you now. First, we're very happy to have with us Susan Hassmiller. She's Senior Advisor for Nursing at the Robert Wood Johnson Foundation and also Director of the Future of Nursing Campaign for Action, sponsored by the Foundation, by AARP, and by the AARP Foundation as well. We're also very happy to have with us Patricia Garrity. She's Professor and Associate Dean for Community Programs at Drexel University and founder and director of 11th Street Family Health Services. That's a nurse-led clinic serving low-income people in Philadelphia. Patty was previously an RWJF Executive Nurse Fellow when she undertook a leadership project to expand the 11th Street Clinic into community-based health promotion. And we're also very happy to have with us Anna Young. She's co-founder of Maker Nurse. That's an initiative supported by the Robert Wood Johnson Foundation to foster innovation in nursing and to give nurses the tools they need to improve patient care. And in a moment, you will hear more about the many ways that Maker does that in very, very innovative fashion. Well, Sue Hassmiller, as we mentioned, the Foundation has had a long-standing focus on nursing and has supported the Campaign for Action to advance nurses' education. Tell us a little bit more about how all of these efforts connect with the Foundation's renewed focus on building a culture of health.
Thank you, Susan. Happy to do so, and thanks everyone for joining us today. I'm excited to say that the campaign is at its halfway mark. We had a lot of 2020 recommendations that we are addressing. The campaign is addressing all over the country, and we are at that 5-way mark. The report is still in the #1 spot, Susan, #1 reason why people go to the website, and we've had a number of successes, one of which is this is the first year in the history of ever that we've had more baccalaureate nurses in the country than any other kind of nurses. 21 organizations have come together to leverage all of their resources, many of the nursing organizations, to say that we are all interested in building leadership capacity and we're going to work together to do that. There's a new website that will be going live called Nurses on Boards Coalition, 10,000 nurses by 2020. We're doing very well with diversity, getting nurses to actually look like those who they serve. And it's not to say that we don't have a lot more work, and we actually do. But now, with this new mission on building a culture of health, I can't think of a more perfect agenda for nurses, really. Nurses really understand, and you'll hear from Patty Garrity and Anna, nurses really understand those factors in a person's life that keep them healthy in the first place. You know, food supplies and exercise and how to avoid stress if you can in your life. So there's a lot of factors that are attributable to a person's health status, and nurses really understand that. So now with our Campaign for Action, we're going to encourage everyone who's involved with us to think more broadly about these other health factors. And the great news is we're not forgetting about the IOM recommendations, because I always say if you want to be a great builder of a culture of health and be a significant partner with others in the community, at the state, the national level, to really address this broader health agenda, you've got to have credentials behind your name. You have to keep advancing your education. You need to really look like those you serve, and you have to keep building your leadership capacity. If we're going to be great builders, if we're going to be great partners with those who are building a culture of health, it just is fitting now that we pay attention to those recommendations more than ever.
So there really is, as you say, just a whole lot of synergy between the traditional focus of nursing and the Foundation's focus on the culture of health. So Patty Garrity, you live this life in spades. This is core to the function and the whole purpose of the 11th Street Family Clinic. Tell us more about what you do at the clinic and how all that you do for the people you serve connects with the culture of health.
Sure. The 11th Street Health Center, which is now called actually the Stephen and Sandra Scheller 11th Street Family Health Center, since we've just undergone a big expansion, has always been a partnership with the community. It started in 1996 with residents of 4 public housing developments. And one of the important things is when we went there, the community members clearly told us that they were tired of being assessed and surveyed and interviewed by people who would come in and then leave. So what we did was develop long-term relationships and worked with the community to find out how we could, the term wasn't used at the time, but build a culture of health, help them get healthy. And the residents decided that they wanted a health center in their community that was welcoming to them, but also, in addition to providing clinical services, provided ways for them to stay healthy or get healthier. So they wanted a teaching kitchen. They wanted a fitness center. They wanted mental health. They wanted dental health. And we sort of roughed in spaces for all of that. And eventually, all those things were up and functioning. So in addition to coming in for your primary care with the nurse practitioners, we have interprofessional teams. So you might see a nutritionist, and you might take a cooking class. We have them for adults and for children. We very much don't separate the mind and body. So when you hear about integrated care, pretty much in this country, people think you mean you've integrated behavioral health into primary care. And we've done that, but to us, integrated care is much more than that. It's integrating the whole mind and body. And if you look back, traditionally integrated care, it was the relationship between the providers, the staff there, and the patients, focusing on the whole person. And it's informed by evidence, and therefore would make use of all appropriate therapeutic interventions. So the more traditional medical care, plus mindfulness meditation, yoga, stress reduction, all these things. So it looks at the biomedical as well as the sociocultural issues that help create health. And so if, you know, many people talk about healthcare delivery, and health really isn't delivered. Health is created, and it's created by the interaction of people in their environments. And so that's what we're trying to do, have people come into the center, but then also promote a healthy environment surrounding the center so people can maintain those things that they're getting. So we have nurse practitioners, integrated behavioral health specialists, creative arts specialists, physical therapists, nutritionists, social workers, couples and family therapists, just about all the things you would need to help work with families to make them strong and resilient.
And Patty, what do you know about what this has done to improve health in the community?
Well, we know we are beginning. It's been 20 years, but you know, as I said, it wasn't originally called a culture of health. I think one of the biggest changes that we're seeing is we take building a culture of health, I think we add a step, and that is building a culture of health and healing. And you can't have a culture of health unless you've done some healing, and many people shy away from that because it's not always pleasant. It doesn't look nice. Things can look worse for a while. And when we say healing, we're talking about very often the trauma, the load of toxic stress that children and adults have endured throughout their life, and the health problems that have come from that. And so one of the biggest changes we're seeing is people being aware of this, especially in a community like ours that has so much community violence and domestic violence. And so taking that culture of health and healing out to the schools to work together with the churches, with community organizations, and really now seeing people come together with this understanding of how we do things through a trauma-informed lens.
Great, and we'll come back to that very important topic in just a moment. Anna Young, we want to go to you next. Tell us what Maker Nurse is all about. Tell us some of the activities that you're engaged in and how this connects very much with the culture of health in terms of creating more value out of the health care we receive for all Americans.
Thanks, Susan. Yeah, so Maker Nurse is an initiative that started 2 years ago when we asked the question with the Robert Wood Johnson Foundation of what are nurses making at the bedside? How are nurses using tangible fabrication and the hot materials inside of the hospital supply closet to make solutions that make patients more comfortable, that improve care, that improve nurse workflow? And then the second layer that we were asking was, well, what ideas do they have? Because we know that nurses are experiencing these challenges day in and day out, and they are best equipped to solve them. But what we found out was that they don't have the right tools and materials at the bedside to solve them. So a lot of times the solutions, they're resorting to silk tape or tongue depressors. When us coming from our team over at MIT, we had all of these ideas of ways to really enable them to take these solutions for patients to the next level. So we found through an online survey some of the top institutions for making this happen, the institutions, the hospitals that had nursing leadership who was supporting nurses on the front line to do this. We were seeing tons of examples of how nurses were making and sharing, and really a willingness and eagerness to be a part of a community of practice that is making and nursing. So the hospitals who we're working with are in Corpus Christi, Texas, Driscoll, UTMB in Galveston. We're in Richmond, Virginia, with Bon Secours, Brooklyn, New York, and South Shore Hospital right outside of Boston in Weymouth, Massachusetts. And we just reached a really exciting milestone with Maker Nurse where inside of UTMB in Galveston, we opened with David Marshall, the CNO, the first medical makerspace inside of the hospital. So now we're actually able to provide nurses with tools and materials on site so that they can come up with and create and sometimes even inventing new technologies at the front line. So this opened 2 weeks ago, and we've already had over 100 nurses coming through, 15 different prototypes being made in a number of different units, everything from wound care to NICU, making custom bandages on a vinyl cutter that are actually the appropriate size for patients, to another nurse in the burn unit who's creating an irrigation structure with 3D printed clips that will snap onto the bed. So he'll be able to better irrigate and clean patients faster when they come onto the unit. So one of the things that this is showing us and that we're now helping hospitals and nursing leadership to understand is that making and these tangible solutions, sometimes intellectual property is the best way to pursue them and advance them, but more often we're seeing tremendous opportunities to document value that is created for the hospital and for the system and for the patients, whether that is cost saving because you're able to do something in-house, or whether this is better patient outcomes and reducing the time before discharge because you're able to 3D print a clip that attaches the ventilator to the walker, so patients are getting out of bed much faster. So there's all sorts of really exciting opportunities that we have going forward.
Great. Well, thank you to all three of you. So what we've heard from Sue Hasmiller, first of all, is that nurses have always been engaged in building the culture of health. And now more than ever, with the Foundation's focus on culture of health, there's a clear connection between the goals of the Campaign for Action, that is to say, having nurses be better educated, and Sue, you mentioned the successes there in terms of the numbers of baccalaureate nurses in particular. Getting more nurses on boards of hospitals and health systems. Those goals are completely in sync with having nurses have an even greater role in culture of health and need to be at leadership levels that have systems focus more on these very important issues that all go into building a culture of health. And Patty, as you said, you all have been living this for 20 years at 11th Street, really providing the entire array of services and supports for patients, going back to the issues of whatever trauma they've suffered in their lives, as well as meeting their healthcare needs to really build that culture of health. And now we've just heard from Anna about the enormous creativity that can be captured in the nursing workforce to use very simple materials to put them together, create new tools for the betterment of care and for the betterment of the health of patients, and really capture much more value as a consequence. So thanks to all three of you for making those extremely important points. Sue, I want to go back to you and talk a little bit more about this important role of getting nurses on more boards. And you mentioned of the new website that's now going to be created. That obviously bringing nurses right to the floor of making some important decisions at the health system level about the focus going forward is so important. What kinds of things do you think will be most instrumental in achieving that goal going forward?
Thank you, Susan. I did want to make the point, too, that Anna's work with the Maker Nurse, it's so important because we always say that leadership at every level is so important. It doesn't take a chief nursing officer or the director of this organization or that organization to be a leader. We know that all nurses can be leaders in their own way, and I think Maker Nurse is a really good example of taking bedside nurses and tapping into, you know, you're there, nurse, you see the solutions, why don't you just come up with them, create them? So I love that notion of Maker Nurse leadership at the bedside. You know, in terms of nurses on boards, we learned a long time ago, even before we started the campaign and the IOM report, because we did a study with Gallup. We did a national study, and we found out a lot. And we found out that nurses, are really not well represented on boards. The only data that we have in this country about board representation comes from the American Hospital Association, and they do a survey of their boards about every 3 to 4 years. And in 2011, they did a survey and found that about 6% of all of the board slots and hospital boards were taken up by nurses, and now that's dropped. We're down to 5%, and some leaders are saying it's really more like about 2%. And what we say is that it's great. I mean, we are so thrilled to be working with lots of partners, our physician partners and attorneys and policymakers and important leaders in the community, but to not also have, in addition to all of those wonderful leaders, a nurse who can really represent the views of, as Patty calls them, residents, Anna calls them patients, some people call them consumers, but we really believe that nurses have, you know, the pulse on what consumers, patients, residents need, may want, and to be on the board would be additive for those boards. We, you know, as I said, we've come together with all of our organizations, and we're going to track. We're gonna have a website go live in a couple of weeks called Nurses on Boards Coalition, and you know, it'll look like sort of a thermometer, but people will come to our website and answer 5 simple questions, and we will begin to count the number of nurses on boards and where they're at. And you know, way beyond hospitals, nurses should be on chambers of commerce and the Y and many different kinds of boards to add to that voice as to how we're really going to build a culture of health in this country.
Great. Well, thanks so much. So Patty Garrity, I wanted to come back to you. One of the very important aspects of trauma are the so-called adverse childhood experiences. And you have firsthand information about the degree to which the people you served, many of them have suffered with adverse childhood experiences, which, as we know from a number of studies conducted over the years, are very much correlated with a lot of chronic illness. Tell us what you know about that connection in the population you serve, and what you think you've been able to achieve in terms of, as you said earlier, acknowledging that the hurt is there, that the healing needs to take place, and that this really is an important part of getting people to a healthier state over the long term.
Well, I think most people are familiar with the classic ACEs study that was done at Kaiser, but it was done on a mainly white, college-educated population. So we were privileged to get some grant funds and replicate that study in 850 adults at our center. And indeed, we're able to document that our rates of childhood adversity were much, much higher. Actually, 49% of the adults at 11th Street in the study said they had 4 more ACEs out of 0 to 10. And we know there's a cumulative effect of that trauma. 38% of our adult women have admitted to being sexually abused before age 18. So this information is so important when helping to plan the care for someone. And we have been working for several years now to get sanctuary certification. Sanctuary is a whole organizational approach to trauma-informed care. And in doing that, we change the way we work with patients, and instead of saying what's wrong with this person, we say what's happened to this person. And we start to know their story and their life experiences and take that into account when we're caring for them. And I think it's very much like years ago when we started to screen for domestic violence. Many people said, well, if I ask that question, what am I going to do with the answer? We don't have services for that. So the great thing, one of the great things to me about 11th Street is we ask those questions. We ask even parents about their child's trauma histories, and then we have an interprofessional team to start addressing that and bring the services in that they need. So for us, looking at things through a trauma-informed lens is very, very important.
And when this happens, what effects do you see over the people you're able to support this way?
We see people. I almost want to do it like this, because I think of we have a creative arts therapist, and we know that you can't deal with trauma without the creative arts. Much of the trauma happened at a pre-verbal stage, and people can't talk about it. And so when you start to move, to draw, to sing, to drum, it starts releasing it, and then they process that. So we've seen a huge change in people. People who were constricted by things that happened in their lives are now opening up, also developing some trust in providers, in themselves, and in others for the first time in their lives.
Really remarkable, and obviously helping them cope with their other conditions as well, I'm sure. Well, that really sums up so beautifully the compassion and the creativity of nurses. And so, Anna Young, to go back over to you, you've got people working on these solutions for patients partly out of frustration that things aren't working better, but bring to bear their initiative to really produce these kinds of solutions. As you think about even broadening these activities, I know you're planning to expand this beyond nurses. So let's talk about the next iterations of Maker Nurse that you have in mind.
So when we started Maker Nurse and started having these conversations at the bedside and inside of hospitals, it was amazing to see that nurses were so quick to, brush off and undervalue what they had come up with. So that was part of us is helping them to recognize what they're doing is very innovative. And then the second was they were really quick to point to others in the system who are making. So respiratory therapists, occupational therapists. I mean, healthcare is really a team. The providers are working as a team for patients. And so Maker Nurse is growing into a broader initiative called Maker Health. So it's exciting for us because this is led by nursing, and really nurses are at the forefront of this making and creativity, but they're also the first to open the doors and And we're working with them to think about how do we bring everybody to the table, and what does healthcare look like when you have nurses and patients, maker patients, working together. When we went into the home care setting, so in South Shore Hospital, the nurses on that team were so quick to and so excited to show us what patients were making with Home Depot materials to manage their feeding tube and attach it to an IV pole. So so you had like a custom little cup for that to sit into. So really, it's exciting to think about how do we, now that nurses are getting access to tools and materials, how do we continue to expand that and bring the rest of the healthcare team into the setting?
That's great. What do you think is the most exciting thing you've seen nurses or nurses working with others on the healthcare team create? I know you probably don't want to pick just one.
It's so hard, I know. That's the exciting part, though, exciting challenge to have. But I think so from the UTMB maker space, seeing the volume of nurses come through, and that there was just really, like David Marshall says this, every nurse, where there's a nurse, there's an idea. So every nurse, it's like they've been sitting on ideas that they have. But so Jason Schaefer from the burn unit, he's the burn unit nurse manager, has come through the space and has been there over a 10-day period of time, has made 3 different iterations of a prototype, which is exciting. And his is a system that attaches over the bed in the burn unit, so when patients are first brought in. And what it does is it connects one hose line in the burn unit and then irrigates out through a PVC structure and valve structure to now 4 different ports. So nurses can actually customize how and where they want to irrigate the wounds depending on the patient, and just makes their job a little bit easier and makes the patient's experience much more streamlined and faster.
Really exciting, saving time, getting better care delivered to the patient, and all for the price of products you can buy at Home Depot. Really terrific innovation. So we're going to go now to some questions that have come in from people on the Hangout. And we have a question first from Wanda, who sent in a message on Twitter saying, as CMS releases practice transformation grants, how can nurses be better utilized? And let me just make a point of saying we hope all of you will weigh in with your questions for the Hangout. You can see the Twitter hashtag up on the right-hand portion of your screen. But again, Sue Hasmiller, let's go to that question that Wanda asked. Will these practice transformation grants be able to be used to make better use of nurses, do you think?
Will I just want to clarify the question. Will the transformation grants better utilize nurses in building a culture of health? Is that the question?
I think literally Wanda asked, as the practice transformation grants now will be doled out, how can nurses be better utilized in that context of practice transformation?
Well, as Anna and both Patty have pointed out, sometimes nurses have to be reminded of how innovative they are, and that they do have the solutions. I'm reminded of, again, Anna and Patty have so many examples, but I'm reminded of yet another school nurse in Chicago, Illinois, Sari Lofton, who was, I guess, frustrated at the kids at her school coming in, not having exercised, eating the meals or not having enough food, and she decided to do something about that. She really talked to her students and the faculty about eating right, and didn't just tell them, but show them. Started some gardens in Chicago, and the kids are helping her, plant the garden, pick the food from the garden, and then bring it into the cafeteria workers to show everyone how everyone can really have some healthy meals. So I think nurses need to be, again, reminded. They need to be tapped on the shoulders. You can do this. You've been doing this for a very long time. We're going to make a very, very big deal about this in the campaign. We're collecting stories of nurses like Saria and Patty who are building a culture of health. We'll be identifying and naming 10 nurses. There was a big competition in the country, and action coalitions from our campaign were asked to nominate nurses, in fact, who they felt best exemplified those who are building a culture of health. And so we just had a big advisory committee meeting. So many nurses are involved in this work, and we'll be announcing those winners at our big campaign summit in December.
Terrific. And if people want to find out more information about that summit, Sue, where should they go?
They can go to our website, campaignforaction.org. Thank you.
So the practice transformation grants, probably one obvious thing we should say is that nurses should look at that request for proposals and band together with the kinds of practices that will give them a greater role. Patty, as we go to you, what have you seen your fellow nurse practitioners do outside of your immediate context at 11th Street to really seize upon the opportunities to build the kind of transformation opportunities in all kinds of practices around the country that really will build on the culture of health in the way that you have?
Well, one, I do want to clarify, I am not a nurse practitioner. I'm a public health nurse.
Yes.
And I have to put a plug, yay public health nurses, because they're population focused, and therefore I think sometimes the public health nurses get forgotten about because so many people are becoming nurse practitioners, which is great, but we need more public health nurses. There's a quote I like to use that says, "Man is the only animal that cries because man alone sees the difference between what is and what could be." And to me, that's the hallmark of nurses, especially public health nurses. So what I'm seeing is people go out there and they look at a situation. These nurses are looking at something, and it's very exciting that they're not just saying, oh, let's have more ICUs. Oh, let's have more programs for people with heart disease. And now they're saying, but it doesn't have to be that way. What can we do as nurses in the community to make people healthier from an earlier age? And I see that happening much more with nurses now. It's very exciting.
That's terrific. Let's go to another question that has come in from Regina. She wants to know, Anna, how a nurse can get involved with Maker Nurse. You mentioned a number of places around the country where Maker Nurse is already in place. Do you have to go to one of those places, or can you become involved in another way?
Yeah, so makernurse.org is the website. So everything that I say is on there if you want to reference that later. But we are growing the Expedition site network of institutions who are involved with Maker Nurse in a number of ways. We are running on-site workshops at hospitals. We are setting up maker spaces at additional hospitals and really, fostering that network effect. The second, the thing that I think is really the low-hanging fruit that we set up is a website called Maker Nurse Create, where nurses, regardless of whether or not you have the institutional support or backing, you can join the community of Maker Nurses and submit examples of what you are making, and also learn and read about other examples that nurses across the country are making. So again, that Maker Nurse Create, workshops, maker spaces inside of hospitals, and those resources are all listed on our website.
Thank you so much. We have another question that's come in from Randy on Twitter. She wants to know, how can we begin to create a culture of health and leadership at the baccalaureate level of nursing? And Sue, what a perfect question to direct to you. Sue, we're having a little difficulty hearing you. If you could make sure to unmute.
Yes, sorry, thank you. So let me make a couple of points. As we're talking a lot about a culture of health, and as we are trying to build some great nurses to really understand how to build a culture of health, nurses really have to first understand, I think, what's going on in a community, how to use principles of prevention and wellness, and how to understand those factors that play into a person's health status. And those kinds of teachings occur predominantly at the baccalaureate level and above. So we have a number of different levels that nurses can attain their RN license, a community college, a diploma, baccalaureate, and higher. So my point is to really understand community competencies that really starts to occur at the baccalaureate level. And that's why we are making all attempts in our addressing the IOM recommendations to get as many nurses to a baccalaureate and higher degree as possible so that we can build a culture of health together and really have that community understanding.
And I think, Patty, probably you would add that bringing the public health component in is as important as anything. Do you want to expand on that a bit?
I absolutely do. I think, unfortunately, these days it's not as valued by some people in the curriculum, and it gets shortchanged because some people think anything that's not in a hospital is a good community health clinical experience, and that indeed is not true. One of the things 11th Street strives to do is provide an exemplary community-based clinical experience for the students. Along with that, what our students do is, I've seen this wonderful program emerge here. Dr. Roberta Waite has a Macy fellowship, and she produced the Macy Scholars Program for our undergraduate students. And the Macy Scholars are studying leadership. So the first year it was to have nursing students. Now she has students from several of the disciplines in the college taking a 3-course sequence on leadership. I think programs like that are very important and shouldn't just be special projects, but should be embedded in our curriculum.
Anna, you want to jump in here?
Yeah, no, so I think on our end we see a tremendous opportunity to engage nursing students at the baccalaureate level in learning these tool sets even before they're working on the front line. So we're starting to explore this model with nursing schools, and it doesn't necessarily need to be an entirely separate class, but there's ways that through nurses can actually have access to the tools and materials. Specifically, Patty, one class we're working with is community health. So nurses at UTMB School of Nursing, their community health course, one track of that, nurses are going to be given access to prototyping materials so that when they see challenges in the home that they're going to help patients with, they can actually make something to address that.
So we have another question that's come in from Tony on Twitter. She wants to know what's stopping bedside nurses from becoming leaders and making changes to improve patient health. And Sue, maybe we'll take this back to you, because a few moments ago you said something to the effect that, just to paraphrase, the nurses don't always feel as empowered as they might to understand what changes they can make. So back to that question, what is stopping bedside nurses from taking on these leadership positions?
I think it does start in school when we're learning nursing and how to care for people. It comes from the faculty, it comes from the leadership, the deans, and really empowering those students right at the get-go so that when they hit the ground running, they know how valuable they are to the team and in coming up with those solutions, delivering the best care possible. And we had a program a while ago, Susan, you know about it very well, Transforming Care at the Bedside, and Anna knows about it as well, because I think she took some principles from transforming care at the bedside. And it was about getting everyone on the same page, leadership from the CEO to the chief nursing officer to those managers on the floor, and getting them to understand that it's not always top down. There's a lot that comes at nurses that are top down, and not only from their own organization, from CMS and other organizations, the Joint Commission, but just to take nurses aside and say, we know that you have a lot of people to listen to and a lot of regulation, but you know what? You're with those patients, you're with those residents 24/7. It is you they count on, and so it's really empowering them in that way to step forward and be the leader that we know that they are.
Well, unfortunately, we're coming toward the end of our Hangout today, so I want to ask all three of you. We want to make sure that the nurses and others on this Hangout understand where they can go for more information and more knowledge about these topics. Anna, you've mentioned the Maker Nurse website and the related content. Where else could people go to find out more information about how they can get engaged in the activities of not just Maker Nurse, but the next iteration, as you said, Maker Health?
Yeah, so makerhealth.co is the website where we'll be growing a number of different resources and expanding off of what was really exciting and launched with Maker Nurse.
Okay. And Patty, from your perspective, if people want to know more about the activities of 11th Street, but also more broadly about the kinds of issues you've been addressing there, this holistic kind of approach to care, integration, and so on, and particularly addressing trauma issues, what best advice could you give those folks?
The best advice, I would talk to organizations that are already involved in this and learn from their experiences and try to team up with them, because I find the people who are doing work in trauma are very, very passionate about it and really want to share what they've learned. They can also go to the Sanctuary Institute website. There's a wealth of information there, in addition to what's on, if you just Google 11th Street Drexel, there's a great deal of information there as well.
Terrific. And Sue, we're going to give the last word to you. You mentioned the new website that is coming out on nursing leadership. The campaignforaction.org website, of course, is going to have additional information. And you mentioned the summit that will be coming up in December as well. Any other resources you want to mention for folks as we sign up?
Yeah, I think that you have mentioned them, and I would just encourage all the nurses in the viewing audience to really, look at the nursing associations too, the American Nurses Association, their specialty organizations. Public health nursing is so critical, the Association of Public Health Nurses. That is a way to tap into and learn more about leadership and how you can be involved as a nurse. So I would leave it with that.
Well, terrific. And I want to say thank you so much, Sue Hassmiller, Patty Garrity, Anna Young, for being with us on this Hangout today. And thanks to all of you who are participating on the Hangout with us. We hope that you will join us again next month on November 6th. We'll have our next First Friday Google Hangout. That will be focused on the Foundation's new action framework and on measures that have been derived for measuring how we're going to build a culture of health through collective action across the country. So we hope you'll join us again next First Friday, November 6th for that one. Thanks so much to all of you for participating on the Hangout, and have a great day.
Thank you.
Thanks.